The ACC's Board of Governors is a forum that provides leadership for cardiologists across the country. Since there's been a lot of dramatic changes in the practice of cardiovascular medicine, we thought it might be appropriate to gather the key leaders of the Board of Governors to discuss initiatives of the college aimed at those challenges. So I'm glad to be joined by outgoing Board of Governor Chair Dr. Dick Kovacs, the incoming Board of Governors Chair Dr. Thad Waits, and the incoming Board of Governor Chair-elect, a lot of words there, is Dr. Dipti Itchaporia. Glad to have all of you with us.
Thank you.
We have sort of the leadership. Are you glad to be outgoing? Is that
in just a few hours?
in a few hours? Dick, let me start with you and tell me, what is the role of the Board of Governors and the ACC chapters?
Well, the Board of Governors exists for the purpose of bidirectional communication from the members up to the Board of Trustees leadership of the college and back down in the other direction. There are chapters in every state. There are chapters in Canada, in 11 international chapters now, and in the military as well. So every member is represented.
So you're really the forum. I mean, you really are the passageway from the members to the leadership of ACC.
A very important passageway.
Yeah, absolutely. Tell me, there were tremendous changes. I mean, it seems like every year we get together and we talk about tremendous, but this really was a year of tremendous changes. What do you see as the biggest trends that you've had to deal with?
A huge trend in movement of cardiologists in the United States into affiliation with their hospitals in some way, shape, or form. And the college surveyed membership in the third and fourth quarter of 2010, and about 40 to 45% of people are moving in that direction or have moved in that direction to hospital affiliation.
So that whole process, what it means to them and to people, the few that don't want to get in that situation.
It means that now we have a larger portion of the membership that are affiliated with their hospital or owned by their hospital, but we have a stable population of members that are not affiliated, and we need to balance their needs and wants.
Great. We'll come back to you in a second. Thad, tell me about what do you see as the biggest goals since you're the incoming chair?
Well, as you said, it's been a year of dramatic change and several years of dramatic change. But what I see coming up is a year of opportunity. There are just so many things out there that we can do. One of the biggest things is in our Pinnacle network and our Pinnacle registry, which is outpatient registry.
Right.
And within that, we just have such a huge opportunity. And then we also have lifetime learning, and we're moving toward doing it at the bedside, in the cath lab, in the patient's room, and I think that's a huge opportunity for us.
That sounds intriguing. I'll come back to that. Dipti, you're from California, okay? It's a state of immense change. Talk a little bit about the impact that you see in California, things that Dick mentioned.
Well, I think California is unique in several ways. The most unique is that it has rules against how physicians organize. So we have a corporate bar against the practice of medicine that does not allow hospitals to hire physicians, and that's what makes that the most unique. So what hospitals are doing are pursuing co-management models and foundation models, Kaiser Foundation being the most, most prominent of that. And that's how they're pursuing their integration models with their physicians, rather than actually hiring their physicians. I think the second way that California is unique is that California appears to be a hotbed for a lot of the pilot projects for the payment reforms and healthcare delivery models. So for example, right now, there is a bundled payment pilot project going on for cath PCI in California. As far as hospital, the delivery systems, there is a ACO model going on with the Monarch IPA, and that's the first of its kind being piloted. So California is sort of a hotbed for testing out some of these new novel ways of payment and delivery of health care.
So I'll ask, that's great information, Dick and Thad. Other trends that you see in the state level that's impacting our practices?
I think payer advocacy is going to be huge. I know in the state of Mississippi we've had some issue with Medicaid and with the Blue Cross, and we're organizing within the ACC and within the Board of Governors to be able to systematically approach those problems.
Right. Dick, I was going to ask you, but I also want to ask you about the team building concept. But
that's exactly what I was going to say. Is a trend is and whether it's California, Alaska, or Mississippi or Indiana, where I'm from, team-based care is increasingly important, critical to the management of our patients. one of the shining examples was the door to balloon effort
Right.
and the team-based approach to care of the acute MI patient. The next challenge is the hospital to home initiative
Right.
that's getting a lot of prominence at this meeting, and the need for all members of the team to be part of that effort to reduce hospital readmissions for heart failure.
Big time. Deputy, let me ask you, if you had a crystal ball and you could look into the future, what do you think would be the biggest opportunities that you see for the college and for its members over the next few years?
Well, I think that, there are many opportunities. I think that in this arena of, payment reform, so different delivery systems and different payment reforms, I think that those physicians that can organize around cost containment by focusing in on quality delivery of health care, using appropriateness use criteria, I think those physicians are going to be the best positioned in this new healthcare arena. So I think that going back to Thad's point about Pinnacle Network, using our focus for appropriateness use criteria, participation in a lot of our quality initiatives will help position our cardiovascular professionals in the best place so that they can compete. I'll give you a good example. If a payer decides to pay medical home and they give a group of primary care physicians X amount of dollars, those physicians are still going to have to refer out to cardiologists.
Right.
And I think they're going to look towards those cardiologists that provide the most efficient quality care.
Good, super. Let me close and ask Thad and Dick. There are all sorts of quality initiatives, and there's been an interesting, and I think the state chapters do a great job, but what do you see as being priorities for the international chapters? I mean, that's a new initiative, isn't it?
There is an enormous interest from the international chapters in our registries,
Right.
so that they can measure what is unique to their environment, and these are unique environments around the world.
Thad, are you going to be dealing with that?
Yes, and also to say, while it's not international, our Canadian governors, our
Right.
Mexican governor, with the governor from Puerto Rico, all add a tremendous amount to our Board of Governors. I've learned so much from talking to several of our Canadian governors about the different healthcare systems, and we have a lot to learn from each other.
That's super. Well, listen, you've done a great job. Thank you for serving. I'm looking forward to both of you. You get crowned tonight, is that right?
I'll be John Boehner.
John Boehner tonight. Thank you all
Thank
for joining
you.
us, and thank you for what you're doing. It's great.
Thanks for having us.